Hi, I'm Pat Summerall, and you may recognize me from my NFL broadcast on television. I've been covering professional sports for a lot of years now, and I'm still active today, thanks to the revolutionary world of vision correction. You know, in my job, I had to be able to see the players on the field. I also had stats in front of me at all times, so every angle of vision was important to me. Now, with the Crystalens procedure, I see just as well as I did when I was younger. I'd like to share that with you today and encourage you to ask questions and explore the possibilities of sight with the Crystalens. You'll be happy you did. So let's now take a look at this new technology and see how it works.
Thanks, Pat. Hi, I'm Dr. Shomer, and I'm glad you're taking the time to learn more about your vision. In this video, we will discuss how the eye works and how it changes over time, as well as some of the options available to help you see clearly again.
Whether we're seeing the smiling face of a loved one or a favorite television show, our eyes are our windows to the world. Whether near or far, the young eye can focus on just about any object. But what happens inside the eye to make this possible? As early as the 1930s, Fincham theorized that the eye's natural lens flexes and arches. The purpose of this video is to illustrate this accommodative flexing and arching, which take place in both the natural crystalline lens and in today's accommodative intraocular lenses. As the focus changes from distant to near objects, the ciliary muscles contract, the ciliary fibers slacken, and the crystalline lens becomes more rounded for near vision. This process is known as accommodation. As we get older, however, our eyes lose the ability to accommodate. We may develop cataracts, which cloud the natural lens and can prevent a clear image from forming on the retina.
Today, cataract surgery is one of the safest and most common surgeries, with approximately 3 million procedures performed in the United States each year. After we remove your cataract, it is replaced with an artificial lens called an intraocular lens implant, or IOL. It is important for you to understand that you now have a choice to make regarding the lens you will receive. Standard monofocal IOLs have been widely used for the last 3 decades and generally provide good vision, but because they do not move or change shape within the eye, patients who receive these standard IOLs will likely require glasses for optimal distance or near vision.
Patients may choose to replace the natural lens with an accommodating intraocular lens. Like the natural lens, the Crystalens creates accommodation from distance to near vision by moving along the visual axis. Both the original crystalline lens and the Crystalens also arch or change their radius of curvature to increase their accommodation. They both move anteriorly and flex or arch to increase their focusing power in the intermediate and near ranges. We can now bridge the generation gap with accommodating lenses. They allow us to restore the near and intermediate vision of our middle adulthood.
Now, let's hear from one of my own patients about their Crystalens experience. Can you tell me about how your vision was before cataract surgery?
It was terrible. I couldn't read the signs on the highway, even with my glasses. So,
how about reading?
reading was hard, even with the glasses. I had bifocal glasses and I couldn't.
And then, after the cataract surgery, can you explain what it's done for you as far as your vision?
It has improved my vision 100%. I could see anything, read stuff that I couldn't read before, even with glasses before the cataract.
Tell me about the, what lens implant did you choose?
The multivision.
The Crystalens?
Yes, the Crystal.
HD? Tell me, how do you feel, would you recommend the Crystalens HD lens to other people?
Anybody, really. They're really, my eyesight, I've needed my eyesight on kind of, I did design work, and I wish I could have done this 40 years ago.
How is your color and clarity of vision with the Crystalens HD in both eyes?
The white are so white it's unbelievable now. All the colors are brilliant.
Do you find that you're reading pretty well without the need for bifocals or the need of reading glasses?
Yes, I could read the smallest print
With or without glasses?
without glasses.
Without glasses. Great, that's wonderful. And would you recommend the Crystalens HD to friends?
Yes, to anybody. I've been bragging about it to everybody since I got it. So,
Great. And then who is your, would you recommend Dr. Shomer? Do you think Dr. Shomer did a good job of your surgery?
I sure do. He did an excellent job. Very considerate. Called me up to make sure I was okay. And
Okay, great. Any other words of advice for friends that have cataracts or considering the Crystalens HD?
well, I just guarantee it 100%. It's the best thing that, like I said, I wish I had it 40 years ago.
I trust that you have found this video to be helpful and informative. I have been confidently implanting this lens for some time now, and my Crystalens patients represent many of the happiest patients in my practice. In fact, my father has developed cataracts, and I'm planning to use the Crystalens HD to give him a full range of vision with less dependence on glasses. I am pleased to be able to offer my patients this exciting new technology, and I am dedicated to helping you achieve your best possible visual outcome. Should you require further information to help you better understand the options available, please feel free to ask me or any of our wonderful staff. Thank you.